sinus infections can build up over weeks, resulting in a number of symptoms and discomfort. And knowing the risk factors can help prevent an infection before it happens. So, Dr. Pernas, let's talk about some of the risk factors, starting with a previous history of respiratory tract infection.
Right.
How?
Well, we think the etiology of most sinus infections is that there's some sort of blockage to the sinus, as we were talking earlier. So a upper respiratory infection is basically causing localized swelling in these openings, which is what's really sort of then starting the cycle of non-ventilation of that sinus and then bacterial overgrowth.
Okay. And now, when you mean structural problems within the sinuses, what does that mean?
Meaning that the opening, the drainage pathway is blocked
or
closed off.
And that's often, you see that with someone who has sinusitis?
Right. That's typically what started the problem.
Oh, okay.
Whether it was caused by allergies, respiratory infection, a polyp, or allergies.
And a weak immune system, you're more at risk.
For sure. Sometimes we have patients that have leukemias or lymphomas and they have a weakened immune system. Definitely, they can take longer to get better after a sinus infection.
Okay. And nasal polyps, you just quickly mentioned. So how are these formed in your nasal passages?
So there's a certain percentage of patients that have allergies that will develop polyps. Polyps are basically bags of water that sit in your nose, and they're inflammatory tissues that they take up a lot of space. So when they do that, they block sinuses from draining correctly, and then they can create infections because it's blocking.